Welcome to Global Media Network LLC. Passionate World Talk Radio is a wholly owned subsidiary of GMN. Our motto is Educate, Enlighten, and Entertain. And this morning, our special guest is Dr. Afton Hasset, capital P, small letter S-Y, capital D, who wrote a book called Chronic Pain Reset, 30 Days of Activities, Practices, and Skills to Help You Thrive. And as a fellow member of the Pain Club, that was one of the reasons why I asked Dr. Hasset to come on the air to share with you what she has in her book, and also anything in addition that one needs to know in order to, well, not become addicted to the common painkillers known as aspirin, Bayer, Tylenol, and anything else that really isn't good for your system. So, good morning, Dr. Hasset. How are you today?
I'm well, thank you, Lillian, for having me on. I'm so happy to speak with you and learn more about you and to share some ideas with your audience.
Well, I am delighted that you are here. So one of the things I will ask you is just to give a little background of who you are, maybe explain why you got into pain and opioid management in the first place, because it's not the kind of business that one opts to when they're in junior high or high school and say, I'm going to college for this. That doesn't happen. So please give a little bit of background.
Oh, you're so right. So currently I am a principal investigator at the Chronic Pain and Fatigue Research Center, which is one of the largest pain research centers in the world. My colleagues consist of neuroscientists, other psychologists, physical therapists, physicians, nurses. I mean, it's just a wonderful interdisciplinary crew. We're all at the University of Michigan within the Department of Anesthesiology. But you're right. This was not what I wrote down as a 12-year-old where I thought I would have my career. I got into it quite accidentally. I did decide I wanted to do something in the behavioral sciences. And so I studied psychology and right around the time I was completing my master's, I started working for a large outpatient clinic that had some people with really common conditions you treat: depression, anxiety, panic disorder. And what vexed me was that a number of these fascinating people I was working with also had chronic pain. And so it was really interesting. I felt like I had a whole other layer on top of psychology, because now we're talking about the body too. And I didn't know what to do. I had a supervisor who was so helpful. She said, you know what? This is a great area to study, to learn more about, because there's a really strong connection between our histories, our behavior, our emotions, our thought, our physiology, and chronic pain. And if you go to the University of California at San Diego Medical Library and pull a bunch of articles, I bet you'll think this is interesting too. And so I wasn't convinced that it would be all that interesting until I got into the library. And this is in the olden days when we used to not use the internet to pull articles. We walked in there and picked out big old books and sat down and read through the big old books of articles. And I found an article by this physician named Dan Claw. And he wrote it with a program officer from the National Institutes of Health. And it was a beautiful overview of chronic pain and describing it not as a psychiatric illness, but as a incredible mind-body process, that the brain was heavily involved with how pain is perceived, and thus pain really resides in the brain. And they talked about, because it's in the brain, then the things we do, the things we think, our emotions that we feel, our sleep, everything impacts it. And so having read that, I was like, oh my gosh, this is what I want to do. And that's, at that time I went in, I changed the topic of my dissertation, and it's kind of, I've not looked back since. And then the crazy bit is about 13 years ago, when I joined the University of Michigan's team, I did so to join Dan Claw, the same person who wrote the article that inspired me to get into pain research in the first place.
It's something that the Greeks would approve of, because with their medicine, they also believe that it was mind, body, and spirit. And I can tell you that if I'm in pain, it will wake me up.
Mm-hmm.
Or if I'm in pain, it will prevent me from thinking straight. And
Mm-hmm.
people are saying, oh, come on, Caldwell, get a life. But those who do not have chronic pain do not understand it's one of these insidious little things that kind of creep and crawl into
Mm-hmm.
your system. And
Yeah.
when it finally rears its ugly head, all hell breaks loose.
Yeah.
So, what exactly do you do with people in order to help them recognize their pain? And more importantly, instead of running to the medicine cabinet,
Mm-hmm.
how they set their mind, hold your breath, people, over matter. Is your
Yeah.
mindset?
Yeah. It's so powerful, Lillian. I mean, we typically recommend that people, when they get treatment for chronic pain, that they do a combination of working with their physician, ideally working with a physical therapist who can get you moving safely and well again, and then doing something in the behavioral realm. So that can be working with a psychologist or another behaviorist, or just doing pain self-management, because what is really important is what you do. So I talk about this in my book, that pain is a bully, right? If it's present, it makes itself known. And if you think about your brain as being this marvelous machine that takes in upwards of 10,000 pieces of information constantly, right? Everything, all this information is coming in, the feel of your clothes, what's going on in your tummy, your breathing, how there's an itch somewhere in your body. I mean, all this stuff is going on, but all you attend to is the pain. And that's because pain is such a bully that blocks out everything else. But what we learn is that if we can engage with other things that put pain, the attention to pain in the background, you can improve your pain. And so, like you might have seen athletes that are out there and they're injured, but they don't know they're injured. They play the entire game and then hobble back to the bench and think, oh my gosh, I think I've really jarred my knee. And it's because there's such another state of mind, of attention, of being, and of passion that they don't notice pain, that big bully screaming. So it's just an example of how, we can really amplify pain or we can set it aside. And so we amplify pain when we're stressed and angry and disgusted and really, really mad at our pain. And we make pain recede to the background when we're joyful, when we're engaged with our friends, when we're doing something incredibly entertaining. The pain might not totally go away, but you'll have periods of time where you don't even feel it. And so knowing these phenomena is what we capitalize on in Chronic Pain Reset to help people kind of really, truly start changing their lives.
So you would say also that people who I did childbirth naturally during the 70s when I came in, and we did breathing, the Lamont's
Yes.
method. And except for the final crest, I've got to tell you that the breathing pretty much knocked out your mind saying, you're in pain, start screaming. And people don't understand it. So why can you please explain to people how that comes about? And listen, folks, I went to classes way before I had the child. About 3 months, they taught you how to breathe and pant so you could handle pain. So there's a method, as they say, to this madness.
No, it's brilliant. And so what we know is that pain is worse when we're in fight or flight. So when our hearts are beating a million miles an hour, we're panicking, we're scared, and we're totally freaking out. And that makes our pain worse. When you're breathing, doing kind of a Lamaze thing, you're actually changing your physiology. So when we're panicking in fight or flight, our sympathetic nervous system is on overdrive. That's the part of you that feels like, I need to run, I need to scream, I need to freak. It's how we respond to a big stressor. But you also have another sympathetic nervous system called the parasympathetic nervous system. And that's the part of your body or your nervous system that calms down the sympathetic. And the best way that we can engage the parasympathetic nervous system to make it quell the freaking out is to breathe. And so Lamaze breathing taps into raising the parasympathetic response. Mindful breathing, which is often just becoming more aware of your breath and sitting peacefully and allowing you to focus on following your breath. And when thoughts pop in, you just kind of dismiss them. It's okay. They'll pop in and out, but just kind of focusing on breath. And also there's heart rate variability breathing, and that's breathing at about 6 breaths per minute. That just means you're inhaling for 10 seconds and exhaling for 10 seconds over time. All of these processes change our physiology in a way that really makes pain decrease. And so, Lillian, you're a walking example of that. I mean, you got through childbirth without medication,
Yes.
with
Well,
breathing.
they weren't too much. They really did not want to give you medication unless you really had to have it.
Yeah.
And I mean, the child came out in less than 6 minutes. So it was, by the time they would have gotten a needle into me, the kid was
Yeah.
already crowning. But I do
Yeah.
realize that other people have 1 or 2 days worth of trying to give birth for various and sundry reasons. And I would think that would help you. I know they suggested to me, well, you'd have to learn how to meditate. That will help you with your pain as well. And
Mm-hmm.
that's another way of disassociating yourself
Yeah.
from what's ever causing the pain. Yes?
Oh, agree, Lillian. So again, it is when you're meditating, you're also quelling that stress response, that fight or flight response. And you're also you're taking your focus away from pain, the big bully, and putting it on something else. It could be your breath, it could be an object, it could be a quiet thought. And that makes a huge difference. So yeah, that's another way. And then I wanted to also share, we conducted a study a few years ago with this lovely OB anesthesiologist. Her name is Melissa Bauer, and her team brought in virtual reality goggles into the into the delivery rooms, and we had women who were doing natural childbirth. And one group of them didn't use the goggles. Oh, I'm so sorry. This is a different design. What we did is we made them their own controls. And so all the women got access to the goggles, but they only got to use them every other contraction. And so we wanted to know, number one, would they do it? Number two, would it make them sick? Because virtual reality, some people can get a little bit of motion sickness. And number three, would it give them pain relief? And what we found is that by the time they got to maybe about the third cycle of using the goggles versus not for contractions, they were yelling for the goggles. Give me the virtual reality, because that intense distraction, that meditative state was so powerful in quelling their pain. The virtual reality experience did not make them nauseous. They did very well with that. And their pain was reduced by, I can't remember, but I think it was like 35 or 40%. It was really a robust number. So, again, I think that's that power of one of the most acutely painful situations, is showing how something that really is engrossing and mesmerizing and draws your attention away can help you cope with pain.
Now, the pain management classes that they're now offering, they say, well, we could help you take your mind off your pain. Come in and we'll show you. Is that similar to what you're teaching?
What I'm teaching is really kind of radical. So,
okay, that's even better.
I thought you'd like this. So, I'm trained in positive psychology. I'm very interested in resilience. And I come to this also by accident. I was very interested in depression and anxiety and negative thinking and pain. And once I discovered through a number of my studies that not everybody has negative thinking with chronic pain, and not everybody was depressed, and not everybody was anxious. There actually were a really strong subset of resilient people. I mean, they look so psychologically healthy and resilient, and they were the people I wanted to study. And so I started studying resilience, positive emotions, and interventions to improve mood, life satisfaction, et cetera. And so that's more about what the book is about. So we do several things. We do kind of our traditional pain strategies to help people decrease pain and to learn ways that they can pace themselves better so they're more successful and don't create pain flares, but can do more things. We help people begin to schedule pleasant activities, because life without pleasant activities really isn't kind of not worth living. So many people with chronic pain,
exactly.
They give up the things, right?
Right. Yeah. I was told to work through your pain.
Yeah.
That's the generation I come from. I don't know about the newer ones, but I was told unless you were bleeding buckets and you're on your deathbed, three breaths from dying, they expected you to go out and do what you needed to do. And then, and only then can you say, okay, I surrender. And you see it with all the athletes in the gymnastic team or the ice skating team or even the skiing team. So there has to be a method in their mind of how they're dealing with it.
Yeah. Oh, and I think when it's dealt with healthy, it's using these positive resilience building principles. So what we teach and what we know as a scientist, what I've learned over time is that when people are experiencing positive emotions, when they've got chronic pain, their pain feels less severe. When people are experiencing positive emotions, they're more likely to do things, even though their pain is severe, right? So we have people with, they say their pain is a 7, and they have very negative thoughts, and they are maybe anxious or depressed. They tend not to do anything. But when people have a pain level that's 7, but they feel a little optimistic and they've got a good friend that's kind of moving them along, and they get out and do stuff, they do so much better, right? Not only do they decrease their pain, but they have more richness in their lives. And so what we do in the book is we first spend the first group of chapters talking about the neuroscience of pain and what we've learned over the last 20 years, which is phenomenal. How really pain is all about changes in the structure and function of your brain. So that's what chronic pain is. Your brain becomes very, very good at processing pain. What we want to do is to teach the brain other things, to literally rewire some elements of the brain. And there's been numerous studies that show that just doing activities that you enjoy, that laughing, that doing gratitude journaling, all of those things not only change mood, but some of them can actually impact the structure and function of your brain too. And so we really want to help people reset. And so that's what we do in the second part of the book, where we have what I call a 30-day challenge, where every day you wake up and you look at the book. There's 2 pages, and in those 2 pages is a new strategy or skill that people can try. And they're very, very different skills, ranging from, very standard cognitive behavioral therapy for pain strategies to things more from mindfulness, from positive psychology. So you're thinking about gratitude, purpose in life, bringing awe into your life, doing pleasant activities. And every day people learn a new skill, they give it a try that day, and then decide if they actually like the skill. Because later we'll come back to it and teach them how to make it part of their lives. But at that point, during those 30 days, you're just kind of interviewing skills. You might like one skill and despise another one. And that's totally fine, because some of them are just going to seem stupid to some people. Others will seem totally inspirational and perfect. So that's the kind of thing we want to build our own plans.
So people, for example, with arthritis or osteoarthritis or anything with arthritis, can they use your mindset in order to change their behavior of how they view the pain? Because I know that with me, it gets into a cycle, and it runs its cycle through, whether it's a couple of weeks or a couple of months. But you have to learn how to work with it as well. Exactly.
Yeah. Yeah, exactly. And this really pertains to any kind of pain. So, we think about, chronic low back pain and fibromyalgia, where we do most of our research, but I've also done a lot of work in rheumatoid arthritis, osteoarthritis, hip replacements, lupus, all scleroderma. So I worked with all these patients with inflammatory disorders, with mechanical joint disorders, and with, conditions that we don't necessarily know where the pain is coming from, but we know the brain is driving it. So it's important for all of us to start to use some of these skills if we have pain.
That sounds pretty good. So where can people find your book?
Well, you can find it at aftonhasset.com. It's on my website. There's links to other places you can buy the book. You can buy it directly on Amazon. I checked this morning. They actually have it on sale. So they do that off and on. It's been selling well. And so every once in a while, they'll give a 10% break. So please, please review it, read it. Please join me on aftonhasset.com. I'd love to hear about your experience about it. So thanks for asking about that, Lillian.
You're welcome. And on your website, they can find contact information. You also do therapy sessions, or they can get in touch with you through the university.
Therapy. Yeah, no therapy. I'm purely a researcher these days. I oversee therapists that are doing clinical trials, and so we are always testing therapies. But I no longer actually have the time, unfortunately, to see patients, though I did a lot of that early on. But I'm happy to talk about my research and to hear about people's adventures.
And at least point you in the right direction. I would suspect, ladies and gentlemen, if you contact the AARP, they would probably have information. I know I lived in Michigan for 12 years with the University of Michigan in my backyard. Go contact the school. They'll be more than happy to point you in the right direction. so that
Yes.
you can find, and they probably would even recommend doctors or people who practice what Dr. Hasset has written, and would be more than happy to point you in the right direction. Is there
Mm-hmm.
anything you would like to add before we close out?
Oh, I just think what has really moved me to joy is is hearing about the experiences from patients who are trying the things in this book, and over the years that the stories of people who have looked at different elements, because the skills and strategies we share in the book are all evidence-based. They've all been proven, and a number of them we've worked with ourselves and worked with patients. And so the piece I wanted to add is there's also 11 patient stories in the book that are so beautiful. People who have had various forms of chronic pain, and not necessarily when they got diagnosed and what happened, but really what they learned as humans and what they want to share with others. And these are such beautiful vignettes. So I just wanted to give my patients a plug because they're so amazing.
And I think, too, that if you take what you learn from the book and start talking to your kids about it, it will teach them how to handle pain at a younger age, so that when something does happen, it doesn't shut them down to the point where they are afraid.
Oh, my
Because
goodness.
pain does that. It makes you afraid to do things, especially physical things. And let's face it, this country is based on sports, whether you like it or not. And there's so many things going on, even now for older people, like pickleball, for example, or the one that you throw the bean bag in that we used to call bean bag, but now they have another name for it.
Cornhole.
Thank you. You don't want to be left out. I play bocce with my grandson. Do you know that going and lifting up and down is a real strain on a back that doesn't like it? But I can do it now. And that's because I've done back strengthening exercises. So if you want to keep on joining in the game of life, you have to go out and, yes, take responsibility for taking care of your pain. Yes.
Oh, so right. So true. So true. And find a pain provider that understands and trusts you to understand your body too, and gives you what feels like a sane pain regimen, not 20 different medications. I think Lily and I are kind of on the same place there with concerns about some of the medications and overlap of medications that people are often given to treat their pain, when frequently one of the best things that people can do is just stabilize their sleep. Because most people with chronic pain, I think Lillian, you mentioned this, their sleep is really disrupted, that people wake up a lot. And so one of the best ways just to normalize your sleep is simple but hard to do. Just go to bed at the same time every night and wake up in the morning at the same time every day. And don't vary that over the weekend. And your body likes predictability, but often if you just can normalize your sleep cycle, your pain will get much better too.
And one other thing, disengage from radio, TV, computers, cell phone, tablets. I go to bed at 8:00. My grandson was shocked. He says, Grandma, I go to bed at 8:30. I said, you didn't let me finish. I go to bed at 8. I read until 10.
Nice.
And I read books that don't stimulate my mind, because I want my mind to turn down. Not pump up the volume. So there's no love stories that I get involved in before I go to sleep.
No horror stories.
No horror movies either. No. And if I have to open up something that I know that always puts me to sleep, is reading the Constitution, for example. Very dry passages in there.
But fascinating.
But it puts me to sleep and makes me relax. And that's what you need. I've heard. So my grandson takes melatonin, child version, to go to sleep. He stayed the weekend. He cried because he couldn't go to sleep. And I said, that's because you take a drug to help you go to sleep. Your body has become accustomed to it. I didn't use the word addiction because I didn't want to scare him. But I said, your body got used to it, and now it wants it to help it sleep. You need to learn how to sleep without it. And he said, I never thought of it that way. And of course, the doctors don't explain that when you take aspirin or Tylenol, unless you're taking it for your heart, your body gets used to it, gets addictive, folks. Same thing. Doesn't have to be meth. or OPM.
Yes. Right. Right.
Same
Yeah.
behavior here. Wake up.
Yep.
So, ladies and gentlemen, thank you very much for joining us today. You can view this interview /video/audio all over again at youtube.com/PWR Network _PW Talk Radio, on Facebook.com/Passionate World Radio, Twitter.com, X.com, sorry, /PWR Network, and also on the website, https://PassionateWorldTalkRadio.com. Thank you all very much for listening. And remember, please keep listening.